in the world right now. I'm Nadia, and I'm delighted to be joined this morning by Daniel Powell for this episode of Live Long, Live Strong, Live Healthy. Unfortunately, I am not joined today by my brother, Dr. Anton Vilcek, who is a surgeon. But I promise you, Anton, we will do you justice in this conversation. So, Daniel, very good morning to you. And Daniel is the CEO of Spark Medical. And today we're going to be discussing a very important issue and one that has impacted far too many people, right, Daniel? So first of all, welcome.
Thank you so much for having me. I appreciate it.
Daniel, one of the devices that you, as the CEO of Spark Medical, have created is something to assist people in overcoming opioid withdrawal. Before we get to the device itself, let's discuss the enormity of the opioid crisis in the world.
Yeah, when we started Spark in 2018, the number of just U.S. overdose deaths was about 42,500 Americans a year, which was staggering. Last year in 2023, they're estimated to be well over 110,000 U.S. citizens that overdosed alone, mind you, worldwide, obviously even greater. So over a 2.5 increase in overdose deaths in just 5 years. We actually said when we were starting the company, maybe the opioid epidemic was already over and we missed the peak, and never thought that it would be this bad.
You know, you say that, Daniel. I don't think there's one person who's watching or listening to us who doesn't know somebody who knows somebody who hasn't directly been impacted.
Yeah, every time I tell somebody what we do, inevitably they have a story, and that story is either direct or just one person away from their immediate family that's been affected. It's always heartfelt. You never know when you're going to be sitting at a dinner table and somebody's crying, because it just hits home so much and it's hurt so many families.
So one of the hardest things, if one is addicted or knows someone who is, to opioids, is the withdrawal process. Because we all know the only way to overcome addiction is to stop using whatever it is you're addicted to. And with opioids, the withdrawal is particularly difficult, painful, and arduous.
It's a diabolical drug. It is. So addiction is going to be two components, physical and mental, and withdrawal is a suffering of both of those at an extreme. At first, withdrawal from opioids feels like the worst body flu of your life. One gentleman described it as, 1 minute your bones are boiling and the next they're freezing. It is excruciatingly painful. Then there's an anxiety and a psychological component of absolute fear of what's coming. And most people will tell you who've gone through withdrawal that they literally believe they're going to die. And that's the amygdala in the brain that processes fear and pain completely in a dysregulated state. And so when you look at somebody who's trying to get off opioids and their brain is telling them, if you do this, you're going to die, you can kind of see where this isn't, wow, you need to suck it up, buttercup, have more willpower, you need to be disciplined. It's your fundamental part of your brain's been rewritten to make you, fight for survival. And the fight for survival, you believe the only thing to do is use again.
So that's where you, and I know your partners are neuroscientists, created a medical device.
Yeah, that's right. So we have developed a solution that sends mild electrical pulses to the brainstem and alleviates most withdrawal symptoms. What this looks like in practice is you put this device on your ear. It's stimulating two well-known nerves, one called the vagus nerve, and one's the trigeminal. And you can take somebody in full-blown withdrawal, put this device on them, and about 30 to 60 minutes later, the majority of all withdrawal symptoms are alleviated. We're bringing them out of that fight or flight. We're releasing endorphins, which is alleviating that pain. And it's just quite profound to see work and very consistently work.
So I'm just curious, examples. I mean, you've been doing this for how many years? And, how do you know that this is working?
Yeah, I mean, we've used the gold standard of clinical trial design, which is called a randomized controlled trial, where you have a control group and an active therapy group. This went to the FDA. This is an FDA approved device. Went through all the clinical rigor of testing it. But we're continuing to advance the science, do brain imaging while the system's on, and continually trying to understand addiction, withdrawal, and all the comorbidities, anxiety, depression that go around it better and better.
So just to unpack it, I mean, it's literally something that goes on your ear. I read in some of your literature that it was based on acupuncture. Tell us
Yeah,
more.
we definitely derived the inspiration from acupuncture. So we had the solution 6,000 years ago, just didn't know it. The difference in why this is an improved solution is acupuncture is hitting these same nerves as you put the needle in, but we're using a transcutaneous stem, so like a hydrogel. Think of a TENS unit. Nothing that needs to pierce the skin and cause you to potentially bleed, and we're delivering mild electrical pulses at two very specific intervals that speak the language of the nervous system. So different nerves run on electricity, and so that's why this is working. We're actually sending the signal at very specific intervals.
For anyone who's just joining us, I'm speaking to the CEO of Spark Biomedical, Daniel Powell, and we're talking about a device that Spark Biomedical has come up with to assist people in dealing with this overwhelming trauma, physical and mental, of withdrawal, of opioid withdrawal. So in your experience, have you had anybody who has come back to you and said, as a result of this, I've managed to withdraw in a way that I have tried before and failed?
Yeah, one of my favorite patient feedback, they just wrote easiest detox ever. Just as simple as that. We have a couple of great testimonials, videos. Not a lot of people are willing to film a video and break their anonymity and share their story. We're excited. We got just a new one up in Pennsylvania yesterday that we're going to send a crew out to film. But there's,
Tell us about this person. Tell us more about
I don't have all the details to see it yet, but the previous one we had, Jeremy, just tells it. He starts the video and he said, "This disease killed my aunt. This disease killed my brother." And it's just heart-wrenching. And he talks about his life now, where his father fell in the middle of the night, and he said, if I didn't have this device and I wasn't clean, I wouldn't have been able to get up and get him to the hospital. Just this practical awareness that you can engage with life and take care of people versus being taken care of. It's really heartwarming.
I'm curious, as you listen to us, there are other medications that people take, antidepressants, for example, that there is withdrawal if you stop taking an antidepressant, unless you do it very, very slowly and taper off. And often that's what makes people, let's say, go back. It's not the mental, it's the physical. Would this device work in that way as well?
Well, we're just about to start a study in alcohol withdrawal.
Okay.
So we expand that. And then I hadn't thought of antidepressants. That's a really interesting note. That would be a question for my neuroscientist founding partner to hypothesize on.
Right.
But our goal is to expand to alcohol, which is far more prevalent worldwide and a big problem. That would also give us an indication on benzos, so things like Xanax, which have brutal withdrawal.
Yes, those things where people say, or sleeping pills, people go, oh, it's not addictive. And then I know, again, these conversations, and you'll appreciate, Daniel, at my stage and age in life, when we have dinner party conversations, we say everyone's allowed to discuss one ailment. And then if they've got a grandchild, they're allowed to show one picture of their grandchild, one ailment, one picture, because
And one
otherwise,
dog, one dog
and one
picture.
dog, exactly, and one dog. Otherwise, the conversation gets dominated by people's ailments. Again, reading your literature, it says one of the things you're working on is neonatal opioid withdrawal.
Yeah, this is a problem, I didn't even know existed when we started the company. And you come to find out there's over 40,000 babies born every year dependent on opioids. We don't say they're addicted. The baby didn't do anything wrong. It doesn't have a disorder, but they're physically dependent. And they have to slowly wean. You can't just go cold turkey. You have to slowly wean the baby with morphine every 4 hours. In our first clinical study, which was just a pilot, we didn't even know if a newborn baby's all their nerve attachments were fully developed. There was so much to learn, but we reduced the national average of 24 days of wean time down to below 9 in our first pilot study. So we have a really big clinical study ongoing that finishes this year that will hopefully get this product through the FDA. More interestingly is there's about 5 times as many babies who have a surgery and are put on fentanyl for pain management, gain a dependence, and then are then weaned for a month or two in the hospital. And so we see an application for those babies as well.
So in terms of medical support and insurance and various things, where are you in terms of that? Because I know insurance pays for certain things and certain facilities. And is this a device that would be in overcoming addiction facilities, places people go for inpatient, for outpatient? Because, again, I know that withdrawal is excruciating, and that's why people will go to an inpatient facility.
Yeah, absolutely. We're targeting inpatient and outpatient, and we offer this via telehealth. There's just a lot of people who the circumstances of their life, they can't go to rehab. They can't check themselves in for 7 days. They have a full-time job. They have kids. They have pets. Life is not, I get to go to a retreat for, summer camp for 7 or much less a month, which is really more important. So we offer it via telehealth. It is not reimbursed yet. That is the bane of any startup's existence, is getting through the Center for Medicaid and Medicare Services. Our file is with them right now. We're waiting to hear the results on the initial stages of our request for reimbursement. But that is the single most important thing for us to accomplish next, is get this into the hands, get this covered, and patients access to this technology.
So if anyone listening, watching goes, I know somebody who could benefit from this device. Again, I'm talking to the CEO of Spark Biomedical about this really remarkable, innovative, life-changing device to help people overcome opioid withdrawal, the symptoms. Where would they reach out to you? How do they get
The
access?
best way is the product page, sparrowrx.com. So just like the bird, Sparrow.
Sparrow RX, because that's, again, SPARRORX.com.
OW.
So Sparrow, like the bird, RX.com. Okay. I do want to make sure that people are able to sparrowrx.com. And again, I suppose they could look you up, and I know they can find you on LinkedIn as well, Daniel Powell. Daniel, if you were, right now you're so immersed in understanding the numbers. It's a crisis, an absolute crisis. We talk about young men who die on the battlefields or in Afghanistan or in Iraq, but more people, and it seems to impact more men for some reason, what I'm seeing and reading, and I'm sure there are plenty of young women as well, but there's an age group in this country that is being decimated by opioid addiction.
Yeah, it is affecting a younger generation disproportionately, male disproportionately. What has changed over the last 10 years is it is now affecting communities of color disproportionately. The fentanyl introduction into all kinds of drugs and being snuck, into other drugs that you don't think they're in, or into what you think is a pain pill or something like that has been really brutal. And so we have a disproportionate amount of overdose deaths from fentanyl in those communities.
So our words as we live long, live strong, live healthily is to really understand this crisis and then work to mitigate and overcome the obstacles to going cold turkey. And it sounds like Spark Medical has certainly come up with one antidote to dealing with withdrawal.
Yeah, and I'd like to note that this isn't a cure for addiction, and I want to make sure we're sensitive to that. This is a treatment for a neurological dysfunction, which is what withdrawal is. That is the barrier to engaging in treatment, engaging in therapy, working through the reasons for the original addiction. So I want to be sensitive to that. We are not showing up with a magical cure to addiction, but we have a very important treatment for this neurological condition, which is the barrier for entering treatment.
Daniel Powell, CEO of Spark Biomedical. I am so sad in so many ways that we even need to have this conversation, but we do. And it's been a pleasure talking to you. I'm Nadia Bilchik. I am missing my brother, Dr. Anton Bilchik, today with the Live Long, Live Strong, Live Healthy podcast. And if you want to get in touch with me, my website is nadiaspeaks.com.
Thank you.